Ever woke up feeling like you've been hit by a truck? You might have the flu. The flu, or influenza, is a common but serious virus that affects millions of people each year. It's not to be confused with the common cold, which often shares some similar symptoms. But here's the catch. Unlike a cold, the flu tends to strike suddenly and leaves you feeling much worse. The common symptoms of the flu often include fever, though not always. You might also experience headaches, muscle aches, and chills and sweats. Other telltale signs can include a dry, persistent cough, shortness of breath, tiredness and weakness, a runny or stuffy nose, sore throat, and even eye pain. For some, especially children, vomiting and diarrhea can also be symptoms of the flu. Remember, the flu is more than just a bad cold. It can make you feel terrible, and it hits you suddenly. The flu doesn't discriminate, but some people are at higher risk than others. Just like in a game of chess, the flu can target anyone on the board, but certain pieces are more vulnerable. Let's talk about those factors that can raise your risk of getting a serious bout of flu or flu-related complications. Age plays a pivotal role. Seasonal flu tends to be more severe in young children, especially those 12 months or younger, and in adults older than age 65. Like a crowded market, this virus thrives in places with many people. So individuals who live or work in facilities with many other residents, such as nursing homes, are more likely to catch the flu. People staying in the hospital are also at higher risk. A weakened immune system can be like an open door for the flu. Certain treatments, medications, and diseases such as cancer treatments, organ transplant medications, long-term use of steroids, and HIV/AIDS can make it easier for the flu to enter and may raise the risk of complications. Chronic illnesses are another factor. Conditions such as asthma and other lung diseases, diabetes, heart disease, nervous system diseases, metabolic disorders, problems with an airway and kidney, liver, or blood disease increase the risk of flu complications. Race also plays a part. In the United States, American Indian or Alaska Native people, Black people, and Latino people may have an increased risk of influenza complications. Aspirin use under age 20 can also raise risks. People younger than 20 years of age and are receiving long-term aspirin therapy are at risk of developing Reyes syndrome if infected with influenza. And let's not forget about pregnancy and obesity. Being pregnant or giving birth during flu season raises a person's risk for flu complications. Similarly, people with a body mass index of 40 or higher have an increased risk of flu complications. Knowing if you're in a high-risk group can help you take the necessary precautions and seek medical attention if needed. Because when it comes to the flu, forewarned is forearmed. The flu is more than just a nuisance, it can lead to serious complications. Diving into the heart of the matter, the flu can trigger a gamut of complications. The most common among them is pneumonia, which is a severe infection that causes the lungs' air sacs to fill with fluid or pus. It can be life-threatening, especially to those with weakened immune systems, the very young and the elderly. Next on the list are sinus and ear infections. These are usually mild and often resolve themselves. However, they can become severe and may require treatment with antibiotics. Bronchitis is another complication that can arise from the flu. It's an inflammation of the lining of your bronchial tubes, which carry air to and from your lungs. People who have bronchitis often cough up thickened mucus, which can be discolored. The flu can also lead to a serious condition known as acute respiratory distress syndrome, or ARDS. This is a life-threatening lung condition that prevents enough oxygen from getting to the lungs and into the blood. Even more concerning is that the flu can exacerbate chronic health problems. For instance, those with asthma may experience asthma attacks while they have the flu, and individuals with chronic congestive heart failure may experience a worsening of this condition due to the flu. It's important to take the flu seriously, as it can worsen chronic health problems and may even lead to hospitalization. If you're at high risk or have serious symptoms, there are treatments available. The flu can be quite severe, especially for those with existing health conditions or those who belong to high-risk groups. But don't worry, there are ways to combat it. One effective way to treat the flu is through antiviral medications. These are not over-the-counter drugs, but rather they are prescribed by a healthcare professional. Some examples include oseltamivir, commonly known as Tamiflu, baloxavir, or Xofluza, zanamivir, also referred to as Relenza and Peramivir, which goes by the name Rapivab. What's great about these antiviral medications is that they can help to shorten the duration of your illness by a day or so. So instead of feeling miserable for a week, you might start to feel better in just 6 days. And that's not all. These medications also work to prevent serious complications that can arise from the flu. So they don't just make you feel better faster, they also keep you safer. However, it's crucial to remember that these medications are most effective when taken within the first 48 hours of experiencing flu symptoms. So, if you suspect you have the flu, don't wait too long to seek medical advice. Remember, these medications can shorten your illness and help prevent serious complications. So don't hesitate to reach out to your healthcare provider if you're feeling under the weather. Even if you're not at high risk, the flu can still knock you off your feet. But fear not. Most individuals who contract the flu have a mild illness and don't necessarily need to rush to a healthcare professional. With some well-deserved rest and thoughtful self-care measures at home, you can anticipate feeling better within a week's time. Now, self-care is a broad term. What does it entail exactly? It might involve staying well hydrated, consuming nutritious food, taking over-the-counter medication to manage symptoms, and of course getting plenty of sleep. Remember that even after symptoms subside, a dry cough may linger for several weeks. But here's a crucial point to note. No matter your risk category, if you experience any emergency symptoms, it's vital to seek medical care right away. This could include difficulty breathing, chest pain, ongoing dizziness, or severe weakness. While most people with the flu will recover within a week, it's important to seek medical care if you experience any emergency symptoms.